So I'm Margaret Castillo, Chief Architect at the Department of Design and Construction. I think I need you though. But yesterday there was a vote, for instance, to close Rikers Island and build borough-based jails. So the issue of mental health and well-being and substance abuse is just absolutely critical as we embark on this huge initiative for the city. And just so you know, I have been working with Suzanne and Josh and Kelly on all the things they mentioned. So in some ways will show you how government works, having worked with them for 4 years on the issues of mental health, well-being, and social health, in addition to our active design. So I just have to show you yet again this book, because we use this in our design meetings, and that's what you have to understand, that this book is actually part of our design decision making at every project meeting we have. We have 26 design excellence architects for those 28 agencies, so we're designing police precincts, sanitation garages, libraries, cultural facilities, streets, plazas, all of that. It matters what we bring to the table. Our architects are wonderful, they're global, but they don't have the knowledge necessarily on some of these topics. And as has been said, mental health and well-being is actually maybe relatively new. I mean, I think we know instinctively certain things, but that we actually have evidence now. So for instance, in the to give you an example of design and how mental health and social health might be considered, is this was a very good architect in the 70s that designed a Brooklyn library. Today, we are using the same building, and a project that might start as an HVAC gut renovation would keep the facade. But the architect said, what if the facade actually was more open and developing? This really transforms the experience, not only of people seeing others in the building instead of behind this opaque wall, but it actually transforms the whole street in terms of light and looking back and forth. And this is an example that opened last year, showing how our civic buildings really can be beacons, not only of bringing people together, but walking on the street. There's actually a garden on the side. We've been working with the Mayor's Office of Criminal Justice on a study that shows how our civic spaces and buildings can actually aid in crime prevention in terms of activating the street with multiple things happening. If we can link a library with a plaza, a police precinct with a plaza, they sort of work together as a safe zone. And we're working again with them to develop the initiatives that Josh talked about. Believe it or not, you could go into a meeting with a sponsor agency and say daylight's important, and they said maybe, you know. Well, it depends, you know, how much does it cost? Do we really need it? So we do a lot of renovations, and this would be an example of the effect of having an intervention in an existing building that makes a difference. And in our new buildings, daylight as organizing principles, and also to provide inspiring spaces. So we have amazing resources in the city, but if we can't get them into the buildings, we want people to come and be excited about our civic buildings. And it has to do also with the workplace. So this is PATH in the Bronx. We say daylight access to views are important for people that are stressed. These aren't only the homeless that are coming in here. These are the people that are interacting. So shouldn't our staff workplace wellness be as important as any consideration here? When we talk about anxiety and access to services, people don't always understand where things are. So wayfinding may seem like a secondary thing. You design the building and then you put signage up. But if you have the path that actually, through color, leads them up to the Discovery Center for the children, it makes it easier. There's less anxiety. An entrance to a teen space gives them a place that's sort of their own place. And as I said, we have so many different kinds of sponsor agencies. The Chelsea Health Center, here's where you go get tested for HIV. the architects here, how can we make this less sterile and bring in the tile, which reflects the sycamore trees outside, the wood, everything to do to sort of calm the space for people that are getting devastating news potentially. And as Josh mentioned, domestic violence centers. This shows that, you know, many of the initiatives have with daylight, but, you know, balance with privacy. Warm materials, even comfort such as a kitchenette. This is a one-stop shopping. This is for women that come and can get housing assistance, legal assistance, everything. And this was something that was opened 2 years ago, very important to the mayor and his wife. And natural materials. We're still talking about whether there's scientific evidence, but I think we know people respond to certain tactile materials. And access to nature. So you may think trees are a given, but not necessarily. We do $1 billion of construction on streets and plazas. If there's a gas line under that, there will never be a tree there. Green roofs is now a new local law. We've actually, our prescient, we actually have a green roof that is accessible for the fire department when you want to talk about a stressful job. Gardens and safe spaces in community cohesion. This is for elderly, people with isolation, you know, to have a place where you can sit safely outside. And we also have a variety of spaces too, that ones that want more privacy. There's another garden at the back. This is more open, people watching. And it's interesting, we did not coordinate this, Diversity Plaza, how we take the spaces for people. Again, our plazas are such an important program. I hope we never lose them. And then our two initiatives in the city is turning the tide on homelessness, and also now the borough-based jails will be coming to DDC. So the community and the fear of the community, the first thing we did was meet with the community, and actually in this building there is an auditorium that has been abandoned for 20 years, and it did perk their interest that maybe this shelter won't be as scary as they imagined. So what can we do about that space between the street and the building that actually encourages community instead of this fear of what this community is? The homeless are our neighbors. And as the borough-based jails are coming, we are talking really more about not jailing people, but finding other ways to treat them. So, thank you.